Well, we are continuing our breast health coverage during Breast Cancer Awareness Month, and today we are talking about those who are fighting breast cancer right now in West Michigan. Some are not only worried about beating cancer, but about money. Almost half of breast cancer patients experience some kind of financial distress, and joining us today is Scott Packer, founding board member for the Pinkn Patch initiative. Scott, thank you so much for joining us. You know, facing breast cancer, a tough journey, I can't even imagine, but Pinkn Patch helps lighten those lows. Talk about what your nonprofit offers to help patients.
So our goal is to help people in real time when they're going through these stressful times and going through treatment and dealing with the psychological burden and raising a family. So everyday tasks like doing laundry and house cleaning. In the winter, Michigan's coming up, so we've got winter coming up. So how do they get to an appointment if they're snowed in, or if they slip and fall on some icy sidewalks? So our goal is to help people with those problems.
Yeah, what's the response been like from those who are fighting breast cancer right now? Any stories in particular?
Well, they're just thankful. Our ultimate goal is to really make it easy for people to get the support and the help they need. So that's what we're building right now is a platform where the patient has a monthly stipend, and we've got service providers, and they can actually book and schedule these services themselves without having to ask people and without having to wait. You know, when they need it, they get it. So that's what we're building now, and hopefully we'll be beta testing before the first of the year and be able to launch and help many, many more people.
Talk about why it was so important to start this initiative here and your personal connection.
I do. I've had several just many friends come down with breast cancer, but I was in Miami visiting a friend that was going through it, and I went to treatment with her, and we were sitting there in the waiting room, and a woman came in with a couple small children, and Kim, she said, I don't know how they do it. You know, they get off a bus with a family, and they go home and they have to raise these kids. She said, Scott, I just, when I go home, I just want to sleep. I can't even think about raising a family. So that's when it kind of stuck with me, and it wasn't long after that I was in a Meijer, saw some pumpkins and a breast cancer awareness ribbon, and Pinkn Patch was born. So, and the response has been great. It's been really overwhelming by people, and just getting it started, it's just been wonderful.
You know, a lot of people right now are spending a lot of money for those pumpkins, but they can get a pink one for a good cause.
Absolutely. It's when they see a pumpkin, I want people to think that to view it as a sign of hope. And when they see one on a stoop or in an office, I want them to be able to know that these are helping. Each one of these little pumpkins is helping a family in their neighborhood, in their community, and like I said, I wanted to be a sign of hope, and I think it is. People really like them.
You have a big fundraising event happening? Is that the pumpkins, or is there another one as well?
We've had several. We had a A.K. Rick's event in the beginning of October. Then we had out at a farm in Caledonia, Wildwood Family Farms. We've got a big Pinkn Patch sale of all the ones we have left in East Grand Rapids, actually on my front yard. So we've got 2.5 days to sell the rest of them, and at the end of April we're planning a halfway to Halloween pickleball tournament. Okay. So we're trying to do it year round, so extend that Pinkn buying season and try to raise year round so we can help people, you know, all the time. Yeah.
Well, thank you so much for being here with us.
Thank you, Amber.
All right, to learn more about Pinkn Patch, and if you would like more information about how to help, we'll have a link in the story on our website, woodtv.com.